So hi everybody, I'm Elaine from Cerebra's communications team and welcome to another one of our tea break talks. And today I'm really delighted to be joined by some of the team from the Fetal Research Centre in Barcelona, who, you know, their work really does begin at the very beginnings of life, really. So I'm delighted to have a chat with some of the team today about what they're working on. So I'm joined by Dr. Eduard Gratacos, Dr. Fatima Crispi, and Dr. Francesca Crovetto. So welcome everybody, and thanks for joining me today. And I think, I've been looking at your website, I've read the latest annual report, and it really is about making a difference from the very start, isn't it? Sort of before the baby's even born. So could I hand over to you, Eduard, to tell us a little bit more?
Yes, thank you very much, and good morning, and thank you, Elaine, for this time together. Yes, we are, as you said, we are a fetal medicine group, so we focus on prenatal life. Prenatal life is a critical moment in human development and strongly determines our future health. And of course, the brain is one of our central and most important organs. So whatever happens to the body affects especially the brain during our life in the womb of our mother. Even small changes in the delicate environment of this mother's womb can substantially deviate how our brain is constructed before birth, and that has been our interest over the last, I would say, 15, almost 20 years, to understand how small complications sometimes can be very apparent and sometimes can be very subtle during pregnancy, might have an impact in how this brain is developing and then how it performs later. This is very important because fetal lives is at the same time, let's say, a risk period, but it offers a window of opportunity that's very as well important, because it allows to detect, correct, and hopefully to improve the consequences of these pregnancy problems on brain injury. And we could really prevent a lot of neurodevelopmental problems because we know how important it is, early intervention, early stimulation in preventing, correcting this, thanks to the plasticity of the brain. Even if the damage has been important, and unfortunately in other cases it's not as important. I mean, identifying can help us to correct it early after birth. And we are now investigating how could we as well correct it before birth by, sometimes in most of the cases we could use some medicines, normally more in the range of nutritional supplements rather than medicines. But also there are amazing opportunities for increasing the health of and the growth of the fetal brain by just intervening on the maternal lifestyle, so on the diet, on the reduction of the stress. And so we combine high, let's say, technology diagnostic techniques like ultrasound and MRI focused on identifying how the brain develops in a normal and in an abnormal fashion, but at the same time we are strongly doing research on interventions that are non-invasive but that could really make a difference. And then maybe we can discuss about that during our conversation today.
Yes, and I suppose those are some things, I'm not saying that they'd be easy to do, but they're things that every woman can try to introduce into their lifestyle, sort of eating habits and stress reduction and that sort of thing. So is that something that you've been working on, Fatima? Or use Francesca,
so yes.
Sorry.
That's fine. So I think that to start with, I will briefly summarize a big study that we did in the last years with Cerebra, that we studied a large range of about 1,000 pregnancies, complicated pregnancies that the neurodevelopment of the baby was not fine. And we were first trying to identify which were the factors that were worsening this the development of the brain. So then we identified some things diseases that we already knew, but we identified also the diet of the mother had also an effect on the development of the brain of the baby, and also the levels of stress. So we were doing some questionnaires of stress, measuring the cortisol levels in the mothers and in the babies. The cortisol is the hormone of stress. And we identified that actually those babies who the brain was not developing so well, some of them, when we were checking the mothers were not having the most perfect diet, let's say like this. No, mothers usually think that they eat their best during pregnancy, but sometimes they don't really know how to do it, or sometimes they don't know, or they do it not in the proper way or the optimal way. And then we also realized that those mothers also had higher levels of stress. So arising from that, we said, okay, and also from toxics. We also identified toxics like smoking, alcohol, more prevalent in these pregnancies. So starting from that, we thought, okay, why don't we try to intervene or try to improve the nutrition of the mothers, trying to help them to reduce, and then also maybe avoiding some toxics, no, from these mothers. And as you were saying, no, mothers could try to do that, but if somebody tells us, okay, let's try to eat better and reduce your stress, how I do it, no, how you need tools to improve your nutrition. Shall I go to a nutritionist, but especially on pregnancy, take into account what the nutrients that the baby needs for the brain development? On how I do reduce the stress. I try to get more relaxed. That's difficult, no? So we try to think of how we could help mothers to do that. So I don't know, maybe Francesca can better explain the idea or the design that we thought to create these tools for improving the mothers.
Yeah.
Yeah, so thank you very much, Evelyn. So basically, we decided that we could apply two important strategies that were based on very important scientific evidence in order to improve the lifestyle of our mothers. So as Fatima said, we identified two main fields, let's say. So one was the nutrition field, and the other one was the stress reduction. And inside this field, we identified the best in, let's say, therapy that we could give to our women in order to improve their well-being during pregnancy. But our main goal was not just to improve the well-being of the mothers. Our main goal was to improve the outcome of the baby and of pregnancy itself. So we think that this is we are completely sure that it's the most original study, and it's a very new study that has been done, because we didn't just want to have healthy mothers, but we wanted to have healthy babies and also better and healthy newborns. So the main goal of impact was to reduce the prevalence of important complications during pregnancy. And for example, such as fetal restriction or other adverse prenatal outcomes, such as, for example, preeclampsia or prenatal mortality, or for example, preterm delivery. So as we identified those important fields, we talk and we design our strategies with important professionals from these fields. And for example, for the nutrition, we have been helped by an important group of the hospital clinic that has been published an important studies in the New England Journal of Medicine some years ago, where they demonstrated that if you follow a Mediterranean diet, you reduce your mortality if you are at increased risk of cardiovascular events. So for one side, we follow them and we create with them strategies based on Mediterranean diet principles for our mothers. And for the other side, we have been supported by an institution in Barcelona that created, or let's say that taken from United States, the mindfulness techniques, and supported by the psychiatry department. We created a specific mindfulness-based reduction program adapted during pregnancy. So, so in practical, what we have done was to select women in the need of gestation, around 20 weeks of gestation, and there were women at high risk to have several complications during pregnancy. So we selected them, we proposed to them to participate in our trial, and they have been randomized into 3 arms. One arm was a nutrition program based on Mediterranean diet. The second arm was the stress reduction program based on mindfulness techniques. And the third arm was the usual care arm based on normal obstetric practice.
Okay.
We followed them until delivery, and then we are still following the children until at least 2 years of age in order to assess several neonatal and neurobehavioral tests. So this was like the main structure of the study, and each intervention has been supported by individual and group sections, and then by professionals for sure, and like also as I said, we based all the intervention on very strong scientific evidence, and we also have assessed a lot of questionnaire based on lifestyle, and we also taken some biological samples in order to see if our effect, if our intervention had a biological effect. This study has been conducted from 2017 until 2020. So the last patient delivered before the COVID pandemic in March. And then we are, as I said, we are still following these patients.
Yes. Is there, from what you've just said, is there one that is proving more effective than others? Is the diet more beneficial than the mindfulness, or the other way around? Or is it really the two of them together that make the difference?
Maybe Eduard can answer that.
Well, I think that first I would like to say that this has been a very bold study, because it's really trying to change things in pregnancy by changing its lifestyle. But we knew for years that lifestyle was involved, and we knew that mothers with poorer fetal growth and this affected the neurodevelopment of their children, had more stress, they had poorer patterns of nutrition. But could you really use this as a tool, as a medicine to change? And that was really, it was as well quite, I mean, so it took us some time to convince even our own teams that we were going to do something like that in a hospital. The other thing was that it's not very, I mean, it's surprising for mothers as well. Say, okay, we're going to put you on mindfulness. So you have to explain very well. We have to say it's just stress reduction. Then when they get into the program, they feel very comfortable, because that's really pleasant. I mean, you go there, you are relaxed in a group, they teach you to relax yourself, they give you some exercises for home. But of course you have to do that in a very reproducible way, very scientific manner, because otherwise you have to be sure, you have to give it really like a medicine. So you will do that, and you have to check that they are doing that. Otherwise you cannot be sure that they have done the intervention. And that's why we had to prepare for so long. But once the study, but surprisingly, I mean, many mothers accepted to go into the trial. Not all of them completed the full program, but the results have been really amazing. I mean, we are still in the process of sending them to a scientific journal. Strictly speaking, we are not allowed to present them in full, but I think in, let's say, a relatively private conversation, although it is recorded. But I mean, I think we can say that there has been a very strong effect. So we are extremely happy, and we are sure that this study is going to change many concepts.
Yes.
And it addresses something that is really, really very important, because when we identify problems in pregnancy, it is a very common question from parents, especially from the mother, is, can I do something to improve that? And I think it's very good. We can say that to all mothers, but especially when there is a risk, when there is, I have had preterm births in the past, I have had children that were small. Can I do something to improve that? You could say, yes, you have tools that have a very strong impact. And I can tell you the impact is really amazing. And we are really having even proof that probably this impact is not only reducing the risk of having a small child, but this has a direct effect on the brain of the mother, on the brain of the baby, because they are connected. We are discovering how connected is the brain of the mother with the brain of the child. And this is really, I think it's a completely new world of experiences for the mother. It empowers them, and that it's going to give us a lot of tools for the future. So I think the impact is potentially huge.
Yes.
And surprisingly, and then I have said many things accepting your question, the effect was really strong in both arms. So it's as important to improve diet as to reduce stress, and probably or surely there are cross effects, because when you are following this has been well described in the past, that when you are following let's say a healthy diet, normally you are encouraged to let's say follow healthier lifestyle patterns. And it's also that some foods are really improving your bowels, and this improves your brain as well. So for instance, Mediterranean diet reduces the levels of perceived stress in people. That has been described in the past. And on the other hand, when you are doing a stress reduction and you are doing relaxation, of course, you tend to, let's say, concentrate more in what you do, you eat more consciously, you eat better, you dedicate more time. So one arm fits the other. We cannot say it's just this component of the Mediterranean diet, or it's just this, let's say, 30 minutes meditation. Of course, this is not magics, but you just reduce your stress hormones, your cortisol. That's very good, because there is less cortisol arriving to the baby, and so you create a positive feedback. And this has amazing effects, a very impactful effects. So you can really increase the weight of the baby, and you can improve the way the brain grows. So we are convinced that the results are going to be very impactful. Cerebra has a great deal of responsibility on that, because they supported us for many years, and they have been strong supporters of this trial. And so we hope to present the results shortly. And of course, Cerebra will be among the first in knowing the final data.
That sounds really exciting, isn't it? And the way, as you say, everything fits together, doesn't it? So it's not just one benefit. One thing benefits others. But talking about stress, you know, with the COVID pandemic, I'm sure an awful lot of, well, every pregnant woman will have felt extremely stressed about their health, about their baby's health, about what will happen. And I know you've done some research into COVID in pregnancy, haven't you? Is that right?
Indeed, we've done actually one of the largest, well, the first and largest study on pregnant women to understand how COVID affected the babies. Unfortunately, it was very little. We also tried to understand whether having COVID represented a higher risk for the mother, and there is a small increase in the risk, but fortunately not very much. So, and that has been a very important study that has been recently published in the Journal of Clinical Infectious Diseases. But we have focused as well very much on stress, and maybe Fatima or Francesca can explain that, because we were very interested, because as you have well pointed out, this COVID has had effects at different levels, right? And it has affected all of us, regardless of whether we went through the disease or not, because the stress has been significant. And we, as we argued when we presented our very short-term grants for investigating the effects of COVID, we said, I mean, pregnancy is one of the most delicate moments in your life, and this situation is really affecting mothers. The lack of information is a disease in itself, the uncertainty and the stress that it creates. So we have investigated that, and we have found some interesting things.
Great. So
maybe Fatima and Francesca want to.
Francesca, you want to explain what?
Very brief.
We well, regarding stress, we have important data that during pandemic, pregnant women were much more stressed, and we, for example, compared them with this arm of usual care of impact, and we were completely surprised about the higher level of stress, probably caused by not just by virus, but just pandemic itself. And so we think that also with impact, we have a very important cohort, because we can see things in a normal world without the COVID. So it was, I think, it's very good. It's a very good thing for us to have a comparison with this. And so we were really impressed about this data, and we were talking about the usual care of impact. So the arm without an intervention that was more stressed than, for example, the arm which apply the mindfulness treatment, let's say, the mindfulness intervention. So we hope that this result can be published soon.
Yeah, just to add, not so we had the impact data. So we have the normal levels of stress, And then we had some questionnaires and evaluation of stress in a pregnancy cohort during the COVID pandemic. And we realized that those who were infected were with high stress, those with COVID, but those without the COVID infection that apparently were normal just because of the pandemic, they had very high levels of stress, very similar. Mm-hmm. And then of course, those who had a severe COVID and admitted in the hospital were the more stressed, but it was all the pregnant women in general that had high levels of stress.
Yeah. Difficult times for everybody, isn't it?
Yes.
But, well, thank you so much for joining me today. Just to say that the annual report from Barcelona will be on Cerebra's website. And when we share this video, we'll put a link to your website as well. So if people want to read more about the work you're doing, they can follow the links and have a look. And we'll wait for that report to be published, and that'll be great.
Thank you. So we want to take the occasion, as usual, to thank the invaluable support of Cerebra. I think that what Cerebra does for research and for improving the health of all these children affected by brain conditions is unique, and we have tried to give back to Cerebra all that Cerebra invested on us, and we will be happy to share our data. I'm sure that Cerebra will, and the parents that are supporting will be proud of the advances, the real changes that we introduce in the quality of life of thousands. So we thank you very much. I think what you do is invaluable. So
well, thank you too, and it is really lovely to meet you all and to catch up, and hopefully we can do it again sometime. That would be really nice.
Hopefully not so far in the future.
Hopefully I'll make it over to Barcelona one day. You never know.
Barcelona or in London, whatever, but to meet again. Yeah.
Yes, that would be really nice. Yes. Oh, well, take care, everybody, and thank you again.
Thank you very much.
Thank you.
You too.
Bye.
Bye-bye.
Bye.
Bye.